I was born in the west side of Wilmington, and I was educated in public schools. And then I went into nursing at the Delaware Hospital School of Nursing and graduated from there in 1947. I stayed there and worked in nursery for the newborns for several years, and then I went in to work with Dr. Lamott in ophthalmology and stayed there until I retired. And it was a wonderful experience. Well, it was a wonderful experience. I mean, I don't think there was anything that I didn't like about it. We trained at the hospital, and at that time we went out to the Delaware State Hospital for our psychiatric training, and we rotated all of the different services and lived right there at the hospital. We had our dormitories there. Well, you would start by, if you were on your day shift, we had different shifts that we worked, and you would go in and have your breakfast, and then you would line up for inspection. And they would inspect your uniform. Your hair could not be long and on your collar. You must have all of the equipment that you needed for the day, your scissors, your pen, your pencil, your notepad to take notes for patients. Then you would proceed to the floor where you would receive your report from the evening shift that was going off. And then you were assigned your patients, and then your day progressed from there, and you gave your patients total care. You didn't have all of the caretakers that you have in the hospital today. If you had patients, you did everything for them. Their bathing, their feeding, their treatments, their medications, all that was taken care of by the nurse on the floor. And you were a student at that time. And of course there were graduate nurses there who would oversee what you were doing. I worked in the newborn nursery, and I was working in the same hospital where I had taken my nurse's training. And I don't think they ever thought of me as anything other than still a student. So I just felt that I was never going to go any further than I was. And then someone told me about this opening with Dr. Lamott, who was one of the few ophthalmologists in the area at the time, and said, "You may not want to stay there, but why don't you try it?" So I did, and I just really liked it.
I did mostly the medical dictation. We had no computers then, so they dictated after every patient, and I transcribed for the record. And I also did the bookkeeping. They had a receptionist. Mary was the nurse for Dr. Lamott.
Yeah, great for me because I used to do the transcribing on the patients too. And so I was able to just work in the office and in the operating room, and I just assisted the doctor. I didn't have to really do any office procedures, clerical procedures at all. We had the people who came in, of course, who needed glasses, who had visual problems. Then you had the people who had medical problems with their eyes. You had children whose eyes were crossed, and you had people who had infections in their eyes and droopy lids, or a variety of things. There were a lot of things. A lot of them required surgical correction. A lot of them just required glasses. And that's about it.
We had a lot of employees coming from construction jobs who would get something in their eye.
That's true. Mm-hmm.
That had to be removed, and of course we had to see them immediately.
They were treated much differently over the years because they had, everything was done manually in the beginning, and then suddenly you had different types of equipment coming in to do what they called the refraction, or the correction of the visual problems. And then, of course, in the operating room, there were many, many changes there. because they had cataract surgery that today is done as an outpatient and with under no anesthesia at all, just drops. But then they had it was really quite extensive, and they had to anesthetize the area, and they had needles that had to be threaded by hand and they were imported from Germany, the Grischreiber needles. And if you dropped them, everybody stopped everything and got down and found them on the floor. And so that was one thing. When the people were operated on for cataract surgery, then they would be sent down to a darkened room. They would have sandbags at their heads so that they would not move. They stayed in the hospital for several days.
Oh, yes. Inpatients. Couldn't bend.
Do you remember we had one patient, they said, don't put your head down, you keep your head level. And so they came back to the man came back to the office with his wife, and she said, how much longer do I have to feed him? And I said, why? And she said, well, you said he couldn't lower his head, and so he can't go look at his food, so I have had to feed him. So you see, things have changed considerably since then. You know, the contacts that they had in the very beginning, they had to take a plaster cast of the curvature of the eyeball. It was really quite a big procedure to even consider it. Well, they did it, and they would just, then from that cast, they would have a glass lens.
Well, that was a scleral lenses that covered the entire eye.
The eye. And then gradually they went into the plastic lenses, and then the lenses today are practically like nothing. In the office that we did minor surgery. If a person had a cyst in the lid, we would remove that, and that would be done in the office. And as Lucille said, if people came in who had an injury on the job, we would take care of that if we could. Then some procedures have really evolved from that day too. You had people who had eyelids that turned out, and they used to use a very awful procedure of cauterization of the inside of the eyelid to make that scarring turn the lid back in. Now today they do plastic surgery where they just remove part of the skin and it heals up and it goes back where it should. So a lot of things have evolved over the years that have made things much simpler in that field. But it was very complex at the beginning.
Oh, I remember Ruby used to come in and call her bookie. Remember? Yeah. I was at the desk, and this dear lady, she was so sweet. And she would come in and she'd say, can I use the phone? And on her way out. And I'd give her the telephone, and she would say, I want number 123, 10 cents. And I said, Ruby, you can't use our telephone for that. Why not? Dr. Lamont would let me use it. But that was kind of, she came in, she was funny.
As Lucille said, a lot of them were from older people from downstate. And this woman came in, and she was very feeble, very old. And she said, oh, doctor, I just can't see a thing. And so we looked at her, and her glasses were so dirty that no one could see out of them. So he said, Mary, wash the glasses. So I did. And she said, oh, it's a miracle. But I've never forgotten her either. Well, I really loved it. I wish I had never had to retire from it. I really did like it because it's so satisfying to see people who are so appreciative for vision. I mean, vision is a very precious commodity. And it's very, very rewarding when you can help people in that way.
I'd always wanted to be a secretary, bookkeeper, and that's what I ended up being, and
She was the
I
best.
enjoyed it very much. I can still keep a good book without the computer.